Hello, everybody. So here we go. Module 2 highlights. This is going to cover chapters 11 through 20, but it may have reached back into Module 1 some, so be prepared for that. I have pulled out important slides. It does not cover everything that you're going to be tested on, either in quizzes or in homework, but it just kind of helps you focus because there's so much. So the slides might be a little bit disjointed, but just understand that these basic general concepts I want to highlight so that you think about. So first of all, types of electrophoresis, the different types, blotting technique, southern, northern, western, capillary electrophoresis. There are things that affect it, and different molecules are detected in different ways. You've got to cover a lot of ground. One of the things about medical laboratory science is not only do you have to understand the instrumentation, how to run the machine, how to run the quality control and make sure you're getting good results and accurate results, you also have to know clinical significance for the different things you're testing for. So a lot of information, but I have every confidence you guys are going to be great. So, technical considerations with electrophoresis. There are common problems: discontinuities, unequal migration, the different sizes of the protein. There are unusual bands sometimes when you have contaminated specimens. Specimens are not a single entity. They're a mixture of things, and so that will affect things. So other separation mechanism: absorption chromatography, size exclusion, affinity chromatography. These are all a little bit different. It's truly amazing what has been invented that allows us to learn things about the molecules in our bodies. Okay, then we get into qualitative and quantitative analysis, identifying what the analyte is, qualitative analysis. Retention time in chromatography. Then the reference standard it's compared to, and then you can identify what it is. Analyte quantification, how much of it is there. This is really helpful when you're doing analytes that you have low concentrations for. Other instrumentation, vacuum systems for spectrometers. The vacuum system prevents collisions of ions. And then you have mass analyzers, ion detectors, and tandem mass spec. Those are used often in molecular and in microbiology. There are a lot of things that you'll see it in as you work in different laboratories. So in clinical applications, MALDI-TOF. Excuse me, I need to get a sip of coffee here. MALDI-TOF, mass spec. I've seen this in several microbiology labs. It's the way that microbiology is going to identify bacteria and proteins. ICP mass spec, for drug screens, that sort of thing, and proteomics. Enzyme kinetics, factors governing the rate of enzyme catalyzed reactions, how quickly the enzymes work on things. There are a lot. The coenzymes detect other things, apoenzymes, holoenzymes. There's a lot there as far as the ability to detect things using enzyme reactions. So that's an important concept to understand. Enzymes is proteins. Remember the structure of those: primary, secondary, tertiary, and quaternary. They're enzymes, remember, in different situations denature. And because of that, different things can be determined, and you can find the existence of things. You can find the absence by tapping into these enzyme reactions when you're doing detection or doing analysis. So, labeled immunochemical assay. When you label something, what you're doing is you're attaching a molecule to it that then you can detect later on. Whether it's enzyme, fluorocarbon, chemiluminescence has a chemical reaction which then will emit light, will absorb light. There are all of these different things. The electrochemical, all of these listed here use labeling to help detect the existence of the substance you're looking for. So when it comes to basic concepts and definitions, antibodies are different. They are used in different ways. They're detected differently. Monoclonal antibodies, as you recall, have been used a lot, especially with COVID situation, but they are definitely used a lot in for different medical reasons. Luminometry, okay, using light to detect either by chemiluminescence, bioluminescence, electrochemistry. There are limitations to it, but it's used a lot in chemistry analyzers. There are times like when an analyzer doesn't have the light source locked down, you have leaks in with light which inhibit and give you problems with determining quantities and the existence of it. But it is definitely a commonly used process. So automation in the analytical processes, you'll see that everywhere. Anything that they can get to automate reduces the input of human error. And so there are instruments where they're set up to have several channels, run several things at the same time. This is an important concept to know as you go forward in your in working in different laboratories to be aware of. So considerations for different techniques. Point of care. Point of care is usually done at bedside. It's usually a fast test, in vitro with the strips, cartridges, glucose testing. That is used very, very often to get information about a patient without it being in having to be a large blood draw or something like that. So, plasma and serum protein. When we talk about the clinical significance, the importance of knowing what we're testing for and why, proteins tell us an awful lot. Urinary proteins, for example, tell us things about urinary tract infection. CRP, C-reactive protein, just tells us, if a person is having a heart attack, myocardial infarction, sorry. They can find out things about through the spinal fluid, proteins that are there in the spinal fluid, and as you become a seasoned medical laboratory scientist, you will see more things like this that and become experienced in what we'd be searching for if we're testing for a particular analyte. Going on, there's things like myoglobin, fibrinogen for clotting factors. Again, issues with C-reactive protein, different things. Another interesting aside is beta-HCG is often used in testing for cancer in male patients. So liver enzymes, very important for determining things like hepatitis and cirrhosis and liver function. AST and ALT, which are common, they're analytes in the Chem 14 that is commonly ordered by doctors to determine how a person's blood chemistries are and where they're at in their health. So important things to keep in mind as you go through. It's very easy to just get caught up in the item that we're looking at and forget about the clinical significance, and yet it's very important to be aware of those. More liver enzymes, that ALK-Phos, alkaline phosphatase, very important for dealing with that. A lot of clinical significance there in liver and bone diseases. Also, hormones. I mentioned that earlier. The HCG can be indicative, well, for pregnancy for one in women, but also it also denotes cancer tumors. Sometimes a particular hormone or molecule can be have several different sources. So increases in those levels can have several different sources. So just keeping that all in mind. And then one of the things, the CEA can be used to determine various cancers, markers for cancers. So you'll run into that test, and these are very important things to just keep in mind. I hope this little survey of pertinent slides will help you in focusing. Again, please keep in mind, look at all of the slides, look through your chapters, know your definitions at the beginning of each chapter, and it could help you as you work through the homework to be prepared. Thank you for your time.